presenters today. Our presenters today are CJ Wolf and Dara Johnson Ayodele. And CJ, as many of you know, is a healthcare professional with more than 20 years of experience in revenue cycle management, practice management, compliance, coding, billing, client services, and he is a nationally recognized compliance thought leader. Dara Johnson Ayodele is a JD. She has 10 years of experience in the healthcare law and compliance industry. She has experience working in state government, including working in the office of the counsel to the OIG and in private industry. And we are so very glad to have both of them today, and we will hand it off for our presentation.
Thank you, Kyle, and thank you everyone else for listening in. Dara and I are very excited to present some thoughts and tools for helping you with a compliance program assessment. So let's jump into our agenda just to give you an idea of what we're going to be doing today. And if you've attended our webinars in the past, you know that we like interaction. So even if you don't have a specific question, if you have a comment or best practice, or you're thinking, oh, I tried that once, it didn't work, so I tried this, we'd love to hear that feedback. And we'll, as Kyle mentioned, we'll try to share those comments and ideas as well. So our agenda today, we have three basic sections that we'd like to cover. The first is, why is it even important to assess your compliance program? Is that something I should do? Then we'd like to talk about responding to detected deficiencies. And thirdly, we're going to introduce this free kit that you'll be receiving with your post-webinar email. And we're going to talk about other resources that are helpful when you're performing an assessment. So please be ready to participate in polling questions, as we have a few of those today. So our first section is the importance of assessing your compliance program. Before we get into that, we're going to start with one of those polling questions. So we want to know, when was the last time your compliance program underwent a general assessment? Now, we're not talking about an investigation or something like that. We're talking about proactive work that either you did internally, or maybe you hired somebody to come in and do a general assessment of the compliance program, its structure, the elements, those sorts of things. Has it been done in the last 12 months, within the last 1 to 2 years, 3 to 5 years, greater than 5 years, or you've never performed one? And we're just trying to get a sense of where people are in frequency. I also think it's valuable to kind of see what your colleagues may be doing. We have a lot of attendees on the webinar today, and so it's good to do these types of surveys to find out, okay, what are my peers doing? And we do like to get up to a certain level of participation before we close the poll. So we will be Kyle will be monitoring that for us.
We're at about 40% right now, and it looks like many of you are starting to reply. So in just a minute, we will share that and discuss the results.
And in our webinar today, we're going to talk about some of the differences between maybe a high level or a superficial review versus more in-depth. So, you know, when I ask about, or when we ask about compliance program underwent a general assessment, we're not being really specific. You can interpret that any way you prefer.
I would agree with you, CJ. Just any evaluation of your compliance program as a whole, or even in part. We just want to get an idea to see who has performed one in the past.
All right, we've got a solid 75%. So we will close the poll now and share the results.
Wow, that's great. Look at this. So 39% have within the last 12 months. That's, you know, we're going to talk a little bit about frequency. That's a really good practice. But we also have a large number, 26% within the last 1 to 2 years. And then you can see it going down 15% for 3 to 5 years, 8% it's been greater than 5 years, and 13% have never performed one. So this might be a really good webinar to kind of kick off the opportunity to do one or to plan one. So thank you for sharing, and thanks for participating. So let's jump into some of our content as to why is this even important. We're going to refer to a couple of different source documents, and most of us in compliance know of the US sentencing guidelines. That's where compliance programs are spelled out in Chapter 8. when it comes to organizational sentencing and those sorts of things. And then we're also going to talk about the DOJ's guidance. But this first slide is from the sentencing guidelines. One of the things that it states is the organization shall take reasonable steps to evaluate periodically the effectiveness of the organization's compliance and ethics program. You know, and what this really means is we've moved beyond, you know, compliance as a profession, as an industry, is relatively young in the grand scheme of things, right? Formal compliance programs maybe around 30, 40 years. And initially it was just great to have a compliance program. Well, we've matured and enforcement agencies are expecting more than just having a program, just having some sort of manual or binder or window dressing, but having something that's effective. And that's why we're talking about performing an assessment. So on the next slide, Dara, maybe you can walk us through a little bit on what the DOJ says in one of their documents on evaluating compliance programs.
Of course, as CJ stated, these enforcement agencies are now looking to ensure that not just that you have a compliance program or you have policies and procedures, but how effective are they for your organization? So the first one is the corporation's compliance program well designed? We find that, as you guys are fully aware, some programs lack structure or do have some sort of a structure, but was it well designed in the way that it fits your organization? Number 2 states, is the program being applied earnestly and in good faith? So as CJ has stated previously too, it's not just that you have those things and those principles in place, but are you applying them? Is your organization utilizing your policies? Are they following through? And we're going to discuss that later in this presentation. Number 3 is, does the corporation's compliance program work in practice? Again, it's one thing to have these things, but how is it working for you? Are your systems that you have in place, are they funneling up to the right departments? And so these are some things that we're going to discuss in this presentation.
Yeah, and you know, one thing, and I'll get to this next slide in a moment, but one thing with the DOJ is sometimes the DOJ does an evaluation. So if there's an investigation, let's say there was some wrongdoing, maybe there was a bad apple in the organization, they will have to decide, are we going to go after this organization as a whole, or are we going to go after that individual? There's an example, it's called the Morgan Stanley declination, where the Department of Justice, there was a bad apple. There was a managing director who violated the Foreign Corrupt Practices Act, essentially bribes and kickbacks, those sorts of things. But after the DOJ investigated, they determined that Morgan Stanley's compliance program was generally effective, and they declined to prosecute the organization, but rather they went after the individual. So a compliance officer's dream is to have such a program, right? We can't prevent every single thing of wrongdoing, especially when you're a large organization. We can't control every individual's every actions, but if we can set up a program and demonstrate that it's effective through our reviews, that's where you kind of get this buildup and this reputation where there may be a declination to come after the organization, but rather go after those individuals. Now, HHS OIG is another entity where a lot of us in healthcare are familiar with them as an enforcement agency. This quote comes from one of their compliance program guidance documents. I think many of you are aware of those. You can watch our other webinars if you're not, because we've tried to highlight some of those. This one comes from a supplemental guidance to the hospitals. And I think it applies to any provider, even though it was published in the hospital guidance. They said entities should regularly review the implementation and execution of their compliance program elements, which we're going to go over in a minute here. This review should be conducted at least annually and should include an assessment of each of the basic elements individually, as well as the overall success of the program. So we're going to, in a moment, talk about what those elements are. On the next slide, I wanted to highlight kind of the difference between maybe a higher level review and a more in-depth review. Are there nice clear lines as to when you're doing one or the other? Not really, but I think a lot of us know when we have limited time and resources, we might just need to do a quicker review or have one done. You can bring in an external consultant or somebody. You can also do them internally. But this high level, and that's what we're going to try to focus on today, is a high level, and we're going to introduce to you some options for doing a more in-depth type of review at the end of the presentation. But most of our comments today are a high level. Why should we consider a high level review? One, they're a little bit quicker. Two, they're a little less resource intensive. Okay, you can probably get them done with 1 or 2 people doing interviews, asking questions. They are basically, these high level reviews are basically focused on the 7 elements generally and the design. So I've spent many decades in the compliance industry. You could look at these 7 elements for healthcare. You could do the same thing for banking and finance, for the defense industry. So it's more of a elemental approach as opposed to like a content approach. Also, these high levels will identify major gaps, and it's more wide than it is deep. It's not going into checking every little claim and this and that. When we're talking about a compliance program effectiveness review, we're saying, is the program set up? And you can do them both internally. You can have them done externally as well. Now, the in-depth, which we won't focus on a lot today, but we do plan to have another webinar in the future where we can talk about a more in-depth review. These are of longer duration. There's measures of effectiveness, not just design. What's working, what's not working. These tend to be more resource intensive. They are both wide and deep. Okay, so they're trying to cover a lot of geography there. A maturity assessment, we'll reference that a little bit, is how mature is your program? Because compliance is never done. We're always looking to improve. And then again, these can be internal versus external. So on these high level reviews where we're focusing on the elements, Dara, maybe on this next slide, you could talk us through a little bit of what these 7 elements are.
Of course, as compliance professionals, I feel like most of us know what these are, but it's always great to do another evaluation of what they are. So number 1, it's the designation of a compliance officer and a compliance committee. Most compliance programs or healthcare organizations have gone to this place where we've developed and understood that we all need a compliance officer. And having a compliance committee as well as that form of oversight is very important for an organization. The second element refers to policies and procedures, including your standards of conduct. Does your organization have a code of conduct that requires and lists the principles in which your organization must stand by, all of your employees, vendors, and contractors? Do you have policies and procedures that explain and dictate your rules and regulations for the type of work and practices that your organizations have? Number 3 is open lines of communication. What type of communications do you have? A lot of places have hotlines now. I love seeing when organizations have compliance officers that are on the ground and are seen as a partner, in which people are able to just go up to, knock on the door traditionally, or pick up the phone and say, this is the situation we have going on. What do you think? And having that cooperative approach is beneficial for many organizations.
On that point, Dara, sorry, if I could just jump in there. I think a lot of my experience as a compliance officer, most of the information I received was from people in that way. So it was after a meeting, walking down the hallway, and so developing relationships of trust and respect so that people will come to you. Hotlines are important, don't get me wrong, but I tend over the years, as you develop those relationships, it's those informal communications that are just priceless.
I agree, and sometimes those informal communications can stop things from becoming grander issues because you have the ability to work them out cooperatively. Exactly. So the next is training and education. What kind of training do you guys have? Are you guys conducting your HIPAA, fraud, waste, and abuse training? What does that look like? What is the frequency relating to that? Number 5 is internal monitoring and auditing. What does that look like for your organization? Are you looking at incidents that may come through? Are you auditing your claims? Is there any sort of evaluation going on in your organization? And number 6, what's the response to those detected deficiencies? So when you find something, how are you responding? Number 7 is the enforcement of disciplinary standards. So we're going to go into more in depth in this later, but essentially, if you do have policies relating to disciplinary standards, are you following through with them? Is it even? Is it effective? These are some of the things in the 7 elements we're going to discuss today.
Yeah, and these are really important because the free kit that you're getting are based off of those 7 elements. Basically, we tried to design a free review kit for you that's this higher level. It's not a super in-depth, but it's this higher level review. And we decided on some key questions and measures that we thought would be very helpful for each of those 7 elements. So keep those 7 elements in mind, because in section 3 of the webinar, we'll talk a little bit more about what some of those questions might be. So we're going to move on now. Hopefully we've laid the groundwork and the foundation of stating why it's important even to do an effectiveness review. Next, we're going to talk about responding to deficiencies that you may detect and getting resources, those sorts of things. But we're going to start with a polling question in this section. So get ready to answer. Do you feel your compliance program is sufficiently resourced? That may be budget, it may be people, it may be commitment. So we've used this general term of resourced, meaning do you have what you need to do it? Either A, absolutely we have what we need, B, somewhat, but it'd be nice to have some more. C is minimal, we're getting along, but we need some resources. We're getting by, but going without resources. D, not at all. We cannot function effectively. Or E, other. And we'd love to hear your comments and ideas on other.
As we're waiting, we'll go ahead and hit some of the questions we have. One of the questions from Robin was, how does one define periodically?
That's a good question. Some, or as you saw in the HHS OIG, they are expecting something at least annually. Now, does that mean you have to do like a full wide and deep every year? I'm not so sure. There may not be major changes every year. I think initially you probably want to do a really deep and thorough, or maybe let's say you're just starting your compliance program. Maybe for year 1, you do a very brief one, and then you schedule a very deep review for year 2 or 3. Now, both Dara and I'll let Dara comment on this as well, but we've both been involved in consulting, so we've seen hundreds of clients across the country. Best practice is to have at least something done every year, and maybe to have an external set of eyes. You can hire somebody, you can do peer reviews where you agree with a peer to come in and look. To do those every 3 to 5 years, that's basically what I've seen, where you do a deeper dive and or external set of eyes looking at it. Dara, what have you seen, or how might you respond to that question?
I would agree with that. I also do think it also sometimes determines on what size your program is. For some of these larger programs, for larger facilities or with larger entities as a whole, sometimes doing that wide and deep review from an external source more frequently is necessary. Just because the first time you go around or you evaluate the compliance program, things are changing. There's some organizations we work with that have acquisitions, multiple acquisitions in a year. So ensuring that you have an effective review of the compliance program at different points in your organization, it's very effective. But just like CJ, just like you said, I think having those annual reviews at least is sufficient, but having that deeper dive with outside eyes is more effective in evaluating whether or not your program is complete, because we all like to think we're doing a really good job, but other people see things differently.
Let's hit one more question and then we'll get to the poll results. So Linda says that her organization is working on a standalone code of conduct. It's been a part of the employee manual forever, but in compliance, they'd like to see it separated and reviewed and attested to annually. What do you think about that?
I can take this question. This is a question that comes up with our current clients here at Health the City, where a lot of the things we do see is people do have that code of conduct in your employee manual, and that employee manual maybe even in one case was a couple hundred pages long. How often can you attest that that person is actually reviewing every section to the employee manual? We hope so. But having a separate standalone code of conduct where you can have individuals attest during their annual trainings, I believe is a more effective approach in understanding that this employee probably viewed it that time when it's only a couple of pages long or maybe 1 or 2, versus having it in that full employee manual where the likelihood of them actually going through it is less. We would all hope so, but we all know that that may not also occur.
As a former healthcare employee in a health system, I can tell you that never happens. All right, here are our results for our poll.
All right.
It's interesting.
Yeah, it looks like about 57% feel that they're somewhat resourced well. So if we add those first two, absolutely we have what we need, and somewhat, that's what, 73%. So we're looking close to 3/4 of us have basically what we need. But there's a good chunk, 23%, minimally resourced. You're getting by, but you're going without some needed resources. And then there's a few that are not at all, and then we have some others. So I don't know what you think, Dara, about these results, but in general, it looks like most people are feeling like they have some pretty good resources.
Exactly. I'm glad to see that it's a smaller number in the not at all category. So that's at least showing that people, the healthcare industry and compliance has grown to an area where we understand the need to have compliance, but there are a lot of organizations that may not be resourced well. And I think also the COVID pandemic kind of brought light to that, just based on when people had to change how their organization functioned.
Of course, and our survey sample is a little biased. We're preaching to the choir. We're preaching to people who probably have some sort of compliance responsibility, and so you are coming from an organization that at least has recognized its importance. There's a whole bunch of organizations out there that haven't even recognized the importance of a compliance program, and they're not participating today. So we may have some skewed data a little bit.
This is true.
So
yes,
Dara, are you feeling okay with walking us through a little bit on securing resources in some of this section here?
Of course. So as we've been discussing, you guys are stating that you generally do have the resources you need, but some programs and organizations are stating that they may not have all the resources you guys are needed. So how do you secure those resources? So the DOJ, they state in some of their documents is the program adequately resourced and empowered to function effectively? So it's not just do you guys have what you need, but are you also empowered? I think this also deals with how the compliance program is situated in the organization. Some people, put them downstream or put them underneath the legal department. But as you guys are all aware, especially if you're participating today, having an unbiased approach with that compliance program to review that organization standard is really important. And so the next one is even a well-designed compliance program may be unsuccessful in practice if implementation is lax, under-resourced, or otherwise ineffective. These are type of the things that I can say I've seen with certain clients where they are a larger entity. They may have really good resources. They may have a large team of compliance professionals, and it was designed in a way to provide the best results, but implementation is lacking. So even some of the things we discuss with people in my experience is, great, you have all these new policies and procedures, we helped you with them, we put them together. What is your plan of action ensuring that your workforce is educated on these? Are you guys just gonna post them out and say, these are the next 10 new policies, what are we gonna do next? Taking different approaches in how you see the education and the implementation of these programs is truly important. The last one is, are the reporting and investigating mechanisms sufficiently funded? As we all know in healthcare, sometimes our programs do need extra funding. Some people that we hear all the time is, I'm only one compliance officer. Our compliance program is one or two. I don't necessarily have enough time or energy to do all of these things that are required. And for smaller programs, that's super understandable, just giving the finances relating to it. But you may need to advocate for further funding in your program to ensure that you guys are meeting all the necessary requirements and regulatory requirements that are necessary for your organization. Is there any other things you have to say, CJ, about securing resources?
No, I think we have quite a few slides on this, and so we're going to be drilling this home a little bit here.
Yes. So another one, it says, additionally, prosecutors should address the sufficiency of the personnel and resources within the compliance function. In particularly, whether those responsible for compliance have sufficient resources, namely staff to effectively undertake the requisite auditing, documentation, and analysis. This is also just further speaking to what we just spoke about of having the right amount of people. Additionally, it says funding and resources. Has there been sufficient staffing for compliance personnel to effectively audit, document, analyze, and act on the results of the compliance effort? Has the company allocated sufficient funds for the same? Have there been times when requests for resources by compliance and control functions have been denied? And if so, on what grounds? This is another function of ensuring that the rationale behind the decisions are taken into consideration of the whole approach.
And part of the reason that I think we're sharing some of these quotes is, if you feel like you're lacking, these are not coming from us. These are coming from the enforcement agencies. These are the kinds of questions that they want to have answers to. And so that may be helpful as you approach those who make decisions about your resources, to help them see that these are important things to resource and fund.
Exactly. And so taking these questions and asking these and writing them out, even for some people, is something I would advise. If you feel like you're not having those people, especially on the bottom half, that felt like we do not have what we need, these are some questions and some quotes you can directly take from the enforcement agencies and show, hey, this is what we need. How would we respond to this if we had an enforcement action? So the U.S. sentencing guideline here states that to carry out such operational responsibility, such individuals shall be given adequate resources, appropriate authority, and direct access to the governing authority or an appropriate subgroup of the governing authority. This is your compliance committee or your board, having the opportunity to have a direct line of communication with the board when something like this arises, or to give an example for why you need additional fundings or maybe a new FTE to properly resource your compliance department.
Yep.
So this is an example of the first element. It's the compliance officer and compliance committee. So OIG believes an organization's compliance officer should neither be counsel for the provider, I'll get back to you there, nor subordinate in function or position to counsel or the legal department in any manner. While independent, an organization's counsel and compliance officers should collaborate to further the interests of the organization. I say this from a personal standpoint. People think, okay, even if we hire you with a law degree or a law license, you could perform both functions. And having that in most organizations is not going to be effective. Having the person that has the fiduciary duty to the organization to be their legal oversight, be the compliance officer, I will wholeheartedly say this is not effective. It's almost even in a conflict of interest in those positions, and having those things separate is really important. But more importantly, having the compliance officer not report to the legal department is important in this case, because you want to have them have the ability to report to the board and not have a filter between those two.
Yeah, and this is not saying, I mean, it even says at the end, we have to collaborate. As a compliance officer, I've worked very closely and very well with my legal department. So it doesn't mean we shun them. It means we work collaboratively. But as Dara just said, you want to make sure that as a compliance officer, you're able to speak unfiltered to the ultimate authority of the organization. Exactly. So that's a good example of element number one. So these are things that we're pointing out now, where if you're detecting a deficiency or some sort of issue, these might be things to look towards to correct that. So for element number two, remember element number two that Dara reviewed was policies and procedures and a standard of conduct. You want it to fit your organization and your culture. So I'm sharing two examples from one organization that I used to work for. I'm not trying to imply that you have to follow what they do. I like these examples because what they've done, they have a standalone standard of conduct or code of conduct on the left, doing the right thing. This is MD Anderson Cancer Center. They're a state entity, and so most of their policies and those sorts of things are publicly available. That's the other reason I'm sharing it. But their code of conduct here on the left, I really like the way they did it. They tie in the organization's mission, vision, and values, right? So as a cancer center, they have a mission to eliminate cancer. And so they try to tie in that mission into their compliance program and into their standards of conduct. Now on the right of this slide is a corporate compliance plan. Sometimes you'll see it written maybe as a charter. This is an actual plan for their whole corporation, and it outlines more detail of the compliance program. So the one on the left is really a code of conduct for all employees. You might even have vendors review it and certify that they reviewed it. You might have volunteers. So they might not be employees, but in healthcare, we know a lot of important roles are filled by volunteers. And so there's different types of individuals who might review the code of conduct and certify to it. And on the right, it's the compliance plan. That's more of, this is how our compliance program is going to function. These are the elements we're going to have. That might not be for every single person in the organization. Okay, so these are just two good examples that if you feel like you're struggling in writing a code, again, you don't want to just copy and paste. You want to use it as an example to see how did they tie into their values, their mission, and maybe we can develop something that is unique to our organization and culture.
I'll agree with you on that. I like
Yeah.
to also go back quickly that I love when organizations to understand that it's not just boilerplate, but every organization has their own mission, has their own values, has their own services they're providing, and ensuring that those things meet their code of conduct is very important.
Exactly. You know, you might be in the healthcare industry, but what if you're a blood donor recipient and you deal with blood donors and then getting those blood products to hospitals and patients? That's different than if you're operating, a pharmacy maybe, or, I mean, there's going to be some similar elements, but you want to really tie it into what your organization's mission is. For element number 3, Dara explained very well about open lines of communication. And these are some thoughts on what you might do. The OIG, from the OIG, they said generally open communication is a product of organizational culture and internal mechanisms for reporting instances of potential fraud and abuse. This is where I jumped in earlier and I said a lot of the communication I received was direct from employees. It was after a meeting, while we were waiting to start a meeting, stopping me in the hallway. That's because the culture was such that they knew who I was and they were comfortable in reporting that. It's still good to have an anonymous hotline because sometimes people might fear retaliation, or if they know, and sometimes if it's like flat out fraud and somebody's like purposefully breaking the law, that anonymous can really help. The second part of this slide is, has the organization fostered an organizational culture that encourages open communication without fear of retaliation? So when I am doing a review of a compliance program and I'm looking for this, I do a couple things. Number one, I ask random employees, not the ones that the organization has said this person knows the most about compliance. I ask random employees, if you became aware of an issue, how would you go about reporting it? And then I just sit and listen. Oh, I talk to my supervisor. Okay, that's a good response. And then I would probe a little bit further. Okay, let's say the problem is with your supervisor. What would you do? Oh, I would go to their supervisor. Or, okay, what if it's those two? Oh yeah, we have a hotline where I can report anonymously. If they're not aware that they have a hotline, that's an issue. I'm not expecting a frontline employee to know everything about compliance, but you should expect them to be aware that there's a compliance program and that there's a way to communicate issues. Maybe it's a website, maybe it's an email, maybe it's a phone number. We used to print the phone number on the back of their employee badge so that they had it right there, because you're not reporting every day, right? It's rare. You may never report something, but for the one time that you need to report, you want to have it handy. And I also asked them, are you aware that you have an anti-retaliation policy? If you report something in good faith, you cannot be retaliated against. And so that's more of an awareness type of thing. On the next slide, we're going to ask you a little bit about this culture and how you feel it exists. How well established is your organization's speak up culture? What we mean by that is, how well do you feel people are comfortable and not afraid to speak up if they're aware of something? Do you feel that this culture is established extremely well and almost everyone is comfortable? Somewhat well, there may be isolated pockets of hesitancy to report. Minimally well, most individuals do not feel it's safe at all, and not at all. It would be rare to have somebody report a concern or other.
All right, poll is launched. A few questions have come in recently. Griselda, which first of all is an awesome name, had two questions that kind of go together. So I'm going to try to piece those together for you. Her institution's really against creating another committee. Do you have to have a compliance committee, or can you do something else that can show oversight beyond the compliance officer? And then her second statement was, oops, I report to the general counsel. Who should she be reporting to? And at the time it was set up, the only option was the general counsel or the finance division. What do you think about those things?
Yeah, so what you're required, is it required that you not report to general counsel? No, I'm not aware of a law that says you can't. But if you read, so organizations that have had settlements and issues and what are called corporate integrity agreements with the OIG, they will sign those corporate integrity agreements. And in those agreements, it specifically says your compliance officer will not be kind of that language we shared, the counsel or report to them directly. In my experience, best practice is reporting to the president or the CEO and have a direct communication to the governing board. Usually, it might not be the full board. Usually, the governing board will have a subcommittee for audit and compliance. That's usually a good way to report. I've also seen some structures where they may report to like a chief operating officer for things like budget and vacation time getting approved, those sorts of things. But for compliance content, like if they've done a compliance review, they get to report that directly to the president and the board. Dara, what are your thoughts, if you have any on that question?
No, I'm gonna wholeheartedly agree with you. There isn't that I believe that there's a law that says you cannot report to the general counsel, but in the CIAs, most of them agree that you will not. So having that direct kind of communication to a board is exactly what I would recommend.
Right.
And I believe your second question, I think I missed that part.
Was on the committee. You don't have to have one. It especially if you're a smaller, excuse me, a smaller organization, but it is so effective when you can have a committee, because what it does is it spreads the responsibility of compliance away from the compliance officer, and it's really everyone's responsibility. So we would have executives like the senior vice president for human resources. We'd have the chief financial officer, the chief operations officer, the chief medical officer. They were a part of an executive compliance committee. They could support, and with it's not just you, the compliance officer, it's very beneficial to have kind of a committee approach. And I don't know if I interrupted you, Dara, sorry.
No, that is exactly the question.
No, I was going to say, let's hit one more question and then keep moving because we do have a time limit. Isaac says, have you seen a difference in reporting concerns between union and non-unionized agencies?
Yeah, so you have to be careful. I mean, sometimes the hotline is used to report HR concerns, right? Or I didn't get my vacation time, or my boss is being mean to me, or in those situations, I don't really consider those maybe a compliance program issue, but you have to collaborate with human resources, and they have to be aware of those unionized rules and regulations. And so you really need to collaborate.
Thank you.
So on the results, we have 2/3 of us saying somewhat well, but there may be isolated pockets, and 21% extremely well. So, if we add those two together, we're looking at 87%. It looks like most of our cultures feel pretty good about reporting. So thank you for sharing that.
That's at least good news to hear.
Yes. So as Kyle mentioned, we do have to move on a little bit. So how well publicized is the hotline? Again, that's just kind of an awareness thing. On the next slide, we have an example of monitoring and auditing, and there may be two approaches to this. Do you have an annual audit plan? So there's kind of the administrative functions, meaning do you do a risk assessment? Have you developed an overall plan saying, look, 80% of our revenue are these 3 clinical services. You probably should be having a proactive way of auditing those, right? And then you have to save some of your hours for reactive auditing, because you might have a hotline call or an investigation going on. So there's this administrative function versus the tactical that you need to be concerned about. The tactical, what we mean by that is random versus data analytics. How are you going to choose a sample size? Do you have skilled and expert auditors for a given subject matter? You might have certified coders who can do coding reviews, but they might not have the medical background to do a medical necessity review. And so it's making sure that when you're doing an audit, you're pulling in the right subject matter experts. On the next slide, we will start into our third section and try to finish this in the next 5 or 6 minutes. And we're going to start with a polling question. This is where we're going to introduce to you this tool, but we first want to know what you think the biggest challenge is that you might face in performing one of these high-level program assessments. So let's keep it to this high level, not this deep dive. Is it you don't have enough time? Is it you don't have the tools or resources or knowledge to do one? Is there a lack of institutional support or commitment? Or is there something other? Or does this maybe not apply to you?
All right. We've got a couple of questions that we'll kind of try to merge together about reporting. Speak about the power differential. There are people who say in the medical department, there are nurses that are reluctant to call out providers on their concerns. And then a similar question, agencies who say they're open to reporting, but then if something is reporting, an employee is penalized or blackballed or even fined.
Yeah. So, I've seen that in healthcare compliance where we are self-reporting. That's a good practice because no organization is perfect. And I'll just use the coding and billing, for example. If you did something wrong and you report it, I think we have to make sure our expectations are realistic. If you were overpaid, you have to return it. You have to return the money. You can't say, I have such a good compliance program, we found these errors, but don't expect us to repay. So now part of that question though was penalized. If you self-report, OIG and other organizations lower what they call the multiplier. So with fines and those sorts of things, sometimes without self-reporting, you could be paying a multiplier of 3 times, but with self-reporting, you might only be paying a multiplier of 1.5 or those sorts of things. So there is still, it was an issue of non-compliance. So there's still an issue of somebody not following a rule or a regulation. I don't think we can expect a free walk on a lot of those sorts of things. Any of those are my thoughts. Dara, I don't know if you have any.
Yeah, if they were talking about individuals that were being penalized from reporting by the organization level, I think that I would say a gap in your compliance program where HR and compliance and even legal need to evaluate the non-retaliation clause and ensure that people that have the ability to report, number one, can report anonymously, and number two, aren't retaliated against. But
yeah,
that could be something we could speak about offline if you guys had specific unique questions.
Yeah. Last question before we move on to the last section here. Sean says he lacks a compliance committee. He'd like to start one, but doesn't know where to start. Can you provide examples of who should attend and what should the initial agenda be?
Of course. We do this for our clients quite frequently, especially with smaller and new organizations. I would love to help you. We can get more into that later. I know with our standards of time and not having enough, that might be something that we can contact us and we can handle offline if you don't mind.
Yeah, great question though. That's not uncommon. And there are definite ways to do it. So to set up those initial committees and having agendas. So our results here, it looks like the majority of the concern or challenge is not enough time. Yeah, it's time intensive sometimes, or you don't have the tools and resources. So hopefully in this section 3, we're going to take care of that one and give you a tool. Lack of institutional support. Yep, that may be something bigger and you have to fix cultural and expectation issues before you can move on to some of the details. And then we have 17% are saying other. I would love to know what the other challenges are, and maybe if we have time at the end, we'll be able to read some of those. So thank you.
Please put those in the chat so we can evaluate those other parts because I'm curious as well.
Yeah, exactly.
So and we will, if we don't have time to get to all of them, we will send all of the questions to this crew and they can reply to people because we have all of your email addresses.
Excellent.
Thank you.
So I'm going to first share a resource that's out there publicly. OIG has lots of these kinds of resources. basically, this is a resource for boards. Boards are ultimately responsible for oversight of compliance programs. We've done webinars on this. Look at the Healthicity resources page if you want to watch those recordings. But basically, it walks through some high-level questions that the board could ask to assess their compliance program. And you might find some value in that as well in doing your own high-level assessment. Again, future webinars will talk about a deeper dive and deeper tools, but we're going to hold that off till another day. On the next slide, though, we're going to introduce to you this review kit that we created. So it's basically those 7 elements, and you can see under element number 1, we have 3 sub-elements, and we have 1 to 2 questions for each of those sub-element issues that we've identified. Then in columns, and you'll be receiving this both as an Excel file as well as a PDF file, depending on what your preferences are, because it's not just asking the questions, it's making sure that you're documenting the findings and that you're attaching evidence. So if one of the questions is, do you have a code of conduct and has it been reviewed in the last year? You might say yes, but attach the actual code of conduct to it, because what you want to be able to demonstrate over multiple years is how you've improved the program. So you want to have a catalog of all of this information for each year you've done some sort of review. And then we've left a column for comments. So with that said, we're not going to show you every question because you're going to get all this as a part of attending the webinar. But on the next slides, we're going just to highlight a few of the elements and the sub-elements. So for the first element, on the compliance officer and committee, and this might help the gentleman who was asking about a committee, do you have a program? Is there a mission statement for your program? And do you have resources? We've kind of hit that one hard. The compliance officer, are they qualified or are they just filling a hole? You know, is it somebody who's wearing 6 hats already in the organization and you just want to check a box and say we have a compliance officer? What's the reporting structure? We've talked about that already. The committee, what is the membership? You know, I like to have senior leaders on an executive committee. You might have multiple committees, but on a senior compliance committee or an executive compliance committee, I like to have all the executives there. And then are there meetings held regularly and are minutes kept? So you might have some sort of committee named, but if they've never met in the last 12 months, not so sure that's going to be real effective, right? So evidence would be, these are the people who attended and these are the minutes. On the next slide, training and education. Questions like, does compliance training exist? I will actually ask for slide decks and review those when I'm doing my reviews. I like to see completion rates. Show me the money. Show me where the completion rates are. And then, are you actually evaluating for effectiveness? Training, just to do training is not good enough. You need to see, is the training effective? So you might have some sort of pre-test and post-test type of example. Next slide. Are responses to detected deficiencies. So do you have evidence of corrective action plans? So if you found something that happened, did you do a root cause analysis? And then did you design a corrective action plan that's written? And then was that implemented by the right people? Another thing that I often do when I do reviews, especially for healthcare entities, is I follow the money. And the money is basically in the claims you're submitting to Medicare and Medicaid. And so I am checking, have you ever had an overpayment and are you returning overpayments? And are you following the rules with doing appropriate refunds? Again, no organization is perfect. If I do a review of for a client and they say we've never had an overpayment, that is a red flag to me, because that tells me that you haven't done enough auditing, because everyone makes mistakes. And then this last one is enforcement and disciplinary standards. Are you publicizing your disciplinary standards? Are they well known? Do people know the consequences? Is there a history of discipline taken? Again, no organization is perfect. There should be something in maybe a personnel file or a compliance file that says this person, you know, it wasn't a major violation of HIPAA, but they were snooping, they did X, Y, and Z, they were counseled, they were warned, you know, this is their 3rd warning. Okay, now with the 3rd warning, this is the additional penalty that comes with it. And then, are they fair? You know, if a doctor is snooping, is it the same penalty than if, you know, a coder is snooping? It should be fair and consistent. So these are some examples of the questions you'll find in the tool. And then Dara will talk a little bit about, after today's webinar, a future webinar and future in-depth and deeper types of assessments.
Or so what are your next steps? Now you guys are understanding of the fact that you need to have an effectiveness review of your compliance program. So we talked about doing the wide approaches, an overall approach, but how do you go deeper and view what are the necessary, I would say, going through the columns of the organization or the compliance program? So then there you have compliance effectiveness and maturity assessments, which we can talk about later. You need to quantify your program maturity. Are you a newer organization? Is this your 5th year of your compliance program, or have you been there for a decade or longer? How do you identify gaps? And when you identify them, how do you approach those gaps? How are you resolving the issues you're finding? And next one is to develop solutions to increase the effectiveness of your compliance programs. What solutions are you making for those identified gaps? And these are things that we can discuss later in webinars, or even if you guys want to reach out to us, we can get you more information. So if you guys are interested in healthcare compliance programs, as you guys are aware, I'm the Director of Advisory Services with Healthicity. And you guys will receive this slide deck, and you guys could go to our website to learn more information. If you questioned whether your organization had made the right steps, have done these compliance program reviews, or have done ones that are sufficient, or have evolved with your organization, we would love to help you in any way. So.
Yeah. With that said, I think, Kyle, we're to the point where we can take additional questions. I think we have some time.
Yeah, a few more minutes. We'll get to a couple of questions. Robin says one of their biggest struggles is accountability and responsibility. How do you address this?
I'll give an example of one organization that I saw that did it very well. I'm not saying it's possible everywhere, but they put compliance expectations into their annual reviews. So just like, you know, every employee typically gets an annual review of their performance to their job specifically, there may be organizational goals that have to be met. Like, did you complete your compliance training on time? Have you contributed to the compliance of the organization? There's different ways to ask those sorts of things for accountability. Dara?
Yes, this is one that I had in an organization, and it worked very effectively. For your annual review, or in order to get your either cost of living increase or your bonus, you had to bring not only your compliance training or your attestation or certificates, but also make sure you're meeting the culture of compliance as part of one of your key indicators.
Yeah, I think there are a few more questions, but a couple of comments, like you said. One of the comments is on the struggles from Jennifer was there are just too many manual processes to be effective.
I would say here, I would agree. There's some places that it may appear to be manual, but there are a lot of tools out there. So what compliance program tools are you guys currently using? Do you have any program or software that makes those things easier? Not to get too involved in Healthicity's programs, but even using Compliance Manager and the incident management system, it may make things easier for you to document in those terms. And also the reporting functions allow you to produce those reports if needed. So I would say if people are understaffed, sometimes utilizing more tools could be more effective for your program. Or what do you think, CJ, in these cases?
Absolutely. You know, I've been doing compliance for decades. I started with paper and pencil, then moved to emails and spreadsheets. And we're now to a point where we really need to be using smart tools to help us with policy management, training, automatic assigning of training and keeping track of completion rates, auditing, those sorts of things. And you mentioned the tool Compliance Manager that Healthicity has. That's an example of kind of this technology that can help manage what seems like very manual processes.
Awesome. I got time for one more question, then we'll wrap it up. Kay says, what recommendations do you have for developing relationships that will support opportunities for these type of discussions when everyone is working remotely?
Oh, that's hard. My number one approach is boots on the ground if possible. But have you guys in your organization tried what we call water cooler Zoom sessions? Sometimes having those introductions or that lead way of finding out information beforehand, before a meeting starts, allows people to still have that human approach. At Healthicity, we're remote. I've met Kyle in person. I met CJ in person, but also we have the ability before meetings just to have questions on how's your day or what are some of your concerns. That casual approach allows people to provide information of, oh, this is what's currently going on.
One thing,
The only reason we met was because we all went to HCCACI, right?
Yeah. One thing that I do is, rather than make it about compliance and about me, I try to learn what other departments are doing. So we had a research department, and they were launching a huge initiative to get a bunch of people signed up for genetic testing in a population study. And they had this webinar, or well, they did both in person and remote. But I said, look, that's a major area of potential compliance risk. I'm just going to go and meet the principal investigator. I want to go and meet, what are they doing? I want to learn about what you do in your department and just start developing relationships. Compliance takes time to really change the direction of a ship. You think of the Titanic turning on a dime, it doesn't happen. You have this gradual movement, and it can take years in developing those relationships. But I say make it about them and try to find out what they do first. When they know that you're interested in what they're doing in their business unit, then you can start to interject compliance. But in this remote world, it is hard. So I'm not sure I have all the answers there.
All right, wrapping up, thank you, CJ and Dara, for your time and your expertise and sharing. We are going to launch one more poll question. We take feedback for our webinars very seriously, so tell us what you thought of this webinar, how effective it was. And a reminder to everyone who posted questions, if we did not have time to get to your question, I am going to email these to our presenters. You can also visit our blog at healthicity.com and post questions there. Dara and our other compliance experts are always getting alerts when we have questions on our blog, so they will do their best to answer them as soon as they can. Follow us on our social media channels so you can see more great content like this. And thanks so much for being here. As a reminder, you will get a copy of the kit that we reviewed, our presentation slides, and the webinar recording. And if you indicated that you wanted CEUs for this, you'll get a link to your CEU certificate as well. So with that, we will wrap it up, and we will let CJ and Dara say goodbye, and we will see you guys next time. We encourage you to go to our website and learn more about our services that we offer, and definitely register for future webinars.
Thanks, everybody.
Thanks everyone for attending.